Now, in today's episode, I'm talking with hormone expert Reed Davis about the main lifestyle factors that contribute to hormone imbalance and how you can make simple changes in your daily habits to get your hormones back on track. I really hope you like it. So, Reed, we're here to talk about hormones. As I just mentioned to you, many of our listeners are women, over 50. And, they're concerned about these sort of changes going on in their bodies. They want to know why it's happening and what they can do about it. So I'd love to kind of start our discussion talking a little bit about, some of the things that you're seeing in your experience. You said that you've conducted thousands of lab work on hormone levels. What are some of, the most common imbalances that you're seeing in women over 50?
Yeah, fantastic. Well, thanks very much for the introduction and for having me on, and I hope that I can help some people. And I'll just double down on my experience, because I started in the late 1990s testing women for hormone levels and also bone density. I had my own bone density testing machine, and I would go around to different locations screening for bone density problems. And then, obviously, if you have an issue, you might want to look at hormones because they're very much involved in bone density. So that was my first introduction well over 15, almost 16 years ago, I'd say. And so since then, I've become aware of all the other ramifications of hormone levels going down, which happens, actually it's happening before menopause now. It's quite amazing what's happening. You asked me, what have I seen? Well, back in the 90s, you still kind of had women reaching 50. The official age at the time was 51 years old before you hit menopause. Menopause just means you haven't had a period in 12 months.
Okay.
If you haven't had a period in 12 months, you're in menopause. Mm-hmm. So they're not coming back. And then bone density problems and all kinds of issues can arise. At the time, they were just putting women on hormone replacement therapy, very standard, Premarin or progestin or a combination of both. And then what happened, and I do want to give this background because I think it relates a lot to what we're going to be talking about here. In 2001, the Women's Health Initiative, which was a division or study within the National Institute of Health, big government agency, big government study. It was an 8-year-long study, and in 2001, they ended it. They said the study's over because the risks, they finally figured out something we'd known for many years in the natural health community, that they finally said, well, look, the risks of being on this medication is worse than the possible benefits you could get out of it. So we're not even going to finish the 8-year study. We're just going to quit it now and tell women, don't take this stuff anymore. The risks don't outweigh the benefits. Right. Now, the benefits were bone density, and that was about it. The risks were cardiovascular disease, blood clots that could kill you, and all this kind of stuff. So in 2001, women were left with not knowing what to do, and doctors didn't know what to do either. They're not trained in natural therapies and things. And of course, that just opened up a whole new area. I mean, we're very, very busy, but we just blew up. Our business just blew up because we had been doing saliva testing of hormones. We had been doing the alternative route already. And what we saw in 2001 and 2002 and 3 was an explosion in the compounding pharmacies that all jumped on the natural bandwagon. And unfortunately, they never changed their thinking. It was still just, look, if your hormones are low, here's what you can take to feel better. Mm-hmm. And it was really just symptomatic relief for hot flashes and night sweats and all the common things that come about with that. So I wanted to give you a little background. I've been doing this a long, long time. I have tested thousands and thousands of women for hormone levels and worked especially with the menopausal crowd at first. But now, to complete the thought that I started with, we're seeing women go through menopause at 42 instead of 52. And it's kind of a screwy perimenopausal state, a premenopause, perimenopause, where because of stress, now you've heard that word before, stress, right?
Oh, yeah.
So now I started studying stress and all the different kinds of stress. Stress like you know about, but stress you don't know about, the hidden stressors and things that I've made my whole career kind of out of discovering hidden stressors and how to fix them, because they affect the hormones. So women now instead of 49, again, even at 39, they're starting to miss their periods, or their periods are starting to get much closer together. So these are some of the initial stages of stress-related early menopauses or early premenopause or perimenopause. These are the kind of things I'm calling it. So one of the first things that might happen is you start noticing that periods are closer together at first, then they might get farther apart, and then you might miss one. You might talk to women all the time now who are 44, 48, and they're missing periods all the time. And really, you're designed to menstruate normally, let's say, in a normal cycle, way up until your late 40s. That was the sort of original design that I am familiar with. And so that's the first thing that happens. Now, you can jump in any time, but obviously we get moods. We not only get the period issues, and it could be painful menopause, it could be or premenstruation syndrome kind of a thing. You get low libido, you get night sweats, you get hot flashes, you start to have mood issues, mood swings, irritability, again, the lack of libido and these kind of things. You start to gain a few pounds. What I noticed also is that very tightly connected to hormone issues like this is thyroid issues. So that means metabolism starts slowing down a little bit. And if you aren't aware of this, and if you aren't behaving yourself properly, doing all this sort of diet, rest, exercise, stress reduction, taking your supplements, whatever, then you're going to also start to gain weight. And it could be something you're not very happy about. So, we also, now I can go on, but I want to at least give that background there, that these problems that you're seeing, same ones I'm seeing them more often, and I'm seeing them in younger and younger women.
Wow. So, so first of all, just to kind of recap, some of the things that you listed there, like the weight gain, low libido, hot flashes, mood imbalances, metabolism slowing. These are sort of like markers or sort of symptoms, if you will, that things are off kilter, things are imbalanced.
Yeah.
Okay.
Anything that you feel or look at that you don't like is called a symptom. Symptoms are what bring people into the office, because something about the way a person feels or looks, they're not happy with it. It's called a complaint.
Right.
So, people have main complaints. I'm 15, 20 pounds overweight. I'm not sleeping well. My libido's down. I'm kind of cranky. I have foggy thinking. I'm lose my keys, some memory. All this fatigue, especially in the afternoons, and at nighttime, kind of pooped out. Some people do get second winds. Other people, like, they can't get up in the morning. So these are not normal things. Now, we're trained by modern medicine that, that's normal. I watch TV sometimes. I'm just overwhelmed with the amount of drugs that are being pushed on people with symptoms, as if that symptom is a normal thing. Oh, that's normal. I had a 44-year-old woman come to me and say that she'd been having issues around her menstruation time, and she went to the physician, and she wasn't in pain. She just was having a lot of heavy bleeding and some other things, moodiness kind of going around the period. And she went to her physician. Now, she was only 44. And he said, here's a prescription. Here's a prescription. Take this during your period. And if in a couple months it doesn't work, then we'll just do a hysterectomy. This is perfectly normal.
Wow.
Trying to convince her that taking a lot of medication and hysterectomies are normal things. And they're not normal things, in my book.
Right.
Yeah, so those things kind of are what drive me to help people and educate people.
So here's something I'd love to talk about. A number of years ago, I read a book I'm sure you're familiar with called "What Your Doctor May Not Tell You About Menopause" by John Lee.
Great book. That was our Bible by John Lee. Now he did that. He did what your doctor may not tell you about menopause, what your doctor may not tell you about perimenopause, and I had videos of his. And when he was still living, he was a great guy to listen to.
Yeah, so, well, one of the things that he says at the very beginning of his book that resonated with me was something to the effect of, negative symptoms of menopause are not universal to all women. There are many women in other cultures that go through the change, as we call it, and they don't have any problems. So, you were just talking about how we sort of, in our culture, we look at it as being normal, but it isn't normal. So what do you think are some of the contributing factors here? I'd love to talk maybe a little bit about lifestyle, diet, a big part of how we eat impacts our hormones as well as other lifestyle factors. Can you kind of give me your take on some of the things in our lifestyles, the choices that we're making every day that are contributing to these imbalances? Because as you said before, really, menopause just means you stop menstruating. But for many people, it means hot flashes and vaginal dryness and no sex drive, etc. So what are some of the things that we're doing that are contributing to that imbalance?
Well, it's a great question. And, we've used the word stress. What I'll say is that it's actually distress. Now, it's very, very interesting what you just asked me, because the same stressors, or let's say the same forms of distress that are disrupting people's hormone levels and putting them in early perimenopause are the same stressors that cause a lot of other problems, ill health. And lifestyle, as you mentioned, is a big part of it. Now, I have a way of looking at the body that's a little different than some other practitioners. I trained myself with really good mentorship, with great relationships with some doctors and some lab scientists, researchers. So I ran thousands and thousands of labs, and still do to this day. And I actually teach a course now in functional lab work. So I've run all the labs that look at the hidden stressors. Now, because I'm not a physician, I never wanted to nor was allowed to actually diagnose a specific condition. That's for physicians. You go into their office and they pretty much label what they have, and then there's what's called standard of care treatment. It's what your insurance will pay for. It's what the medical board approves of. Oh, if they have that symptom, you can, depending on the number of symptoms, they could form an actual diagnosis. Take fibromyalgia or chronic fatigue or some of these things. They're just exactly like hormone problems. And matter of fact, hormones are part of those things. So there's the symptoms, and then there's the underlying cause or condition, which could be almost anything. I just call it stress or distress. Now, it could be the hormones. It could be the immune system. It could be maldigestion and malabsorption. It could be poor detoxification procedures in your body or processes. It could also be different types of energy production problems on a cellular level. Diet is huge in that area of being able to produce energy, in your cells, and then they know what their job is, and they can do that job. So energy production is really important. Also, the nervous system is really important because nerves basically distribute energy as it's developed. So what I just spelled out for you was HIDDEN, hidden. And you could use that as an acronym to easily remember: hormone, immune, digestion, detoxification, energy production, and nervous system. HIDDEN. In my 15 years, that's what I came up with as the basis of investigation. If you know how to look at certain markers through saliva or urine or stool even, or sometimes blood work, then you can start sorting out all of the stressors and all the effects that stress is having on the body. We start with this basic premise, Melissa, that the body's designed pretty well, that cells don't need to be taught what their job is. They are given a set of instructions, a long time ago, when we were just one cell, and then 2 cells, and then 10 cells, and what have you. So cells are pre-programmed to do their job, and so why aren't they doing it perfectly anymore? So there's this idea that nature is really quite perfect in design, and we grow up, and as long as we feed our bodies really well with great nourishment and all the nutrients, everything that's genetically required, all the vitamins, all the minerals, the phytonutrients, and the essential fatty acids, and all the, we should be okay. If we're breathing good, clean air, and we're drinking good, fresh, clean water, and things like that, that's a good place to start. So why aren't we all perfectly healthy then, if the design is so perfect? And if we're feeding ourselves such great food? Because a lot of us do eat perfectly. And you think, oh, well, you also have to exercise, right? Well, exercise is critical. But a lot of people, they eat right and they exercise, and they're still not well. And then you might say, well, you need rest. You have to go to bed on time and get a good night's sleep. Absolutely true. Our parents taught us that. Go to bed, early to rise, and all that sort of stuff.
That.
Yeah. Now, and so you start to see, well, here's another area that could be out in a person. So diet is really critical, eating all the good nutrients and everything that you are genetically required to get, which isn't in food, right? I mean, the food is so poor quality. Then you talk about exercise. It's absolutely mandatory. Not exercising is as bad for you as smoking. In other words, the deleteriousness of not exercising is really harmful. You have to clean your body out by moving your tissues around, especially the lymph system. One of your main detoxifying organs is the lymph system, and it has to be, you have to move your body to generate flow in that area. Anyway, so diet and exercise are critical, and yet people are doing it to some degree. And then sleep is really important. A lot of people I'll see are not sleeping right. They're not really getting rejuvenating, health generating, detoxifying, brain clearing type sleep. So diet, rest, exercise, absolutely critical. And again, I'm coming up with this idea here for you that the body's designed pretty well. Cells don't need to be taught what to do. Cells make up tissue. Tissue make up organs. Organs make up systems. And everything should be cool, healthy, right? That's our birthright. That's what we're designed to have. And yet, with this poor diet, and we're not sleeping, and we're not really exercising like we're supposed to. Now, there's two other elements to a lifestyle program where I can see. And that is stress reduction and supplementation. So here's another acronym for you, if you will. We gave you HIDDEN, which are the hidden stressors and dysfunctions that we can actually run labs on and look at all that. And the other thing, the solution, if you will, is DRESS. It spells dress. And I actually registered a trademark called Dress for Health Success. And I got that because, first of all, DRESS is diet, rest, exercise, as we've gone over, and then stress reduction and supplements are the next. That spells out dress for health success. Well, because that's the solution to just about any problem. And again, keeping in mind that we don't treat specific diseases like physicians. They will say you have fibromyalgia or chronic fatigue or menopause, some call something a disease. We'll say no. What you have is multiple areas that need improvement, multiple areas of function that can be improved. We can balance the hormones, improve the immune system, either beef it up or quiet it down. It's HI. Digestion, you can improve how well you absorb nutrients. Detoxification, you can improve liver function and lymph function and the other detoxifying organs like the colon and the kidneys and the lungs and the skin. And then, of course, the energy production requires really good proportions of protein, fat, and carbohydrates. That's how you can turn cells back to producing energy at the right rate and quality and quantity, these kind of things. So energy, and then the nervous system, that could require actually physical, massage and the exercise is part of it, chiropractic, acupuncture, and these kind of things should really help your nervous system to keep the nerves flowing and that kind of thing. So the HIDDEN is what we can investigate. We can see what areas need to be improved. But the only way to improve them that works long term is behavior. Diet, rest, exercise, stress reduction, and supplementation. Now, I don't sell any supplements. I don't have my own brand. I've been told I'm leaving a lot of money on the table, but you know what? I'll leave it there because I want to just educate. I want to just do my laboratory work and teach people how to behave, and I don't care where they buy their supplements. I know a few things about supplements, though. And food is such poor quality. You know, there's almost no nutrients in food. Mm-hmm. Sure, there's some, but not like it used to be. When my grandfather grew his own vegetables, that was nutritious. Yeah. We used to go to the neighbor's farm and get manure and mix it into our compost pile. You know, the rich compost and compost the soils. There was nutrients in that food. But today it's pretty depleted, even in organic food. I still recommend organic food because you're going to want to avoid herbicides and pesticides. Mm-hmm. And so, you know, organic food is pretty clear of those poisons, which are very, and that's a form of stress. You know, toxic food is stressful on the body. Right. So anyway, so you want to eat organic if you can, but even that doesn't have enough nutrients because the soils are depleted. So supplements are important to substitute. You do want to take vitamins. You do want to take minerals. And you probably should take some essential fatty acids. Nowadays, almost everyone needs some kind of digestive support. And, of course, you know, men, there's things men should take and there's things women should take. But so supplements are important. So DRE, diet, rest, exercise, SS is stress reduction, and supplements. Now, the stress reduction is the biggest area because I could train you to eat, how to eat, you know, what the right foods for you are. And by the way, we always test for the wrong foods. We test for food sensitivities because those are very stressful too. If you're eating foods your immune system doesn't like, you're never going to be truly healthy. Your immune system's always going to be kind of ticked off. Mm-hmm. And it can cascade, by the way, and get really bad. You can get into leaky gut and autoimmune conditions and all that. So anyway, diet is important, minus the foods that you're sensitive to, and resting in these things. But you've got to supplement for ingredients that aren't there, and reduce stress, like foods you're sensitive to. Now, again, I was talking about how stress reduction is the biggest area. Food sensitivities, top of the list. Then there's parasites, and there's bacteria, overgrowth, dysbiosis. You know, that's too much bad bacteria versus good, friendly flora. Yeast and funguses, they're huge. They're ubiquitous almost. You know, they're certainly rampant. And then even in viruses, you know, we get viruses that get deep in our bodies, so to speak, and they stay dormant. You know, sometimes they raise their ugly head, they get active, and then they go back quiet and things like that. So we have all these hidden internal stressors, and that's the ones that I test for, and that's an area where someone that I've trained could really be helpful. But you know, people could also look around and just see, you know, they're really driving themselves too hard. They work 2 jobs. They have unhappy relationships. They you know, they're breathing bad air. They're drinking the wrong water. They're drinking caffeine, which is polluting their bodies. They're drinking too much alcohol. A little bit's fine. And even caffeine, don't get me wrong, a cup of coffee in the morning is just fine, no problem, unless you're totally on a therapeutic, you know, avoidance. But so there's lots of areas that anyone can look around and find stressors. And then there's areas that you might not be aware of, again, like the hidden things that we talked about.
Can we talk a little bit more about the diet piece, Reed? Like,
yeah.
What are some things in a woman's diet that can contribute to hormonal imbalance? Like, you know, my understanding is that when you eat like a refined grain, for example, that can cause blood sugar fluctuations, which in the long term can cause really wreak havoc on the hormonal balance.
Yeah, you know, and it's really funny. That's a great point. It's funny how the symptoms of low blood sugar are the same as the symptoms of PMS. You know, how do you feel when you have low blood sugar? Kind of tired, you're kind of moody, you know, you can get irritable, cranky, You can be craving. You can have foggy thinking, memory problems, and just feeling pretty crappy when you have low blood sugar. It's almost the same with PMS or these postmenopause symptoms of blah, and truly they're connected. So I've seen this work both ways, where a person doesn't eat right. They eat too many carbohydrates. They're spiking their blood sugar, and it's going up and down and up and down. And it causes insulin problems, and it causes more cravings, and one thing leads to another. And pretty soon you're gaining some weight because you're eating too much carbs. You can also, from eating too much carbs, end up with yeast. We know that yeast, if you have any kind of a yeast overgrowth, you're going to crave carbohydrates. And so, I find everything pretty connected. And as you see, I do go off on tangents because in my mind I'm thinking of all the things it could possibly be.
Right.
But diet's critical. So the most important thing you could do for your hormones, diet-wise, is to maintain steady blood sugar levels, including throughout the night. So you have to understand that there's a correct ratio of protein, fat, and carbohydrates. And I'll give all the listeners a takeaway. They might want to write this down. So it's genetically required. Everyone has a little bit of genetic differences, but we all need a certain amount of protein, fat, and carbohydrate. Carbohydrates should be non-refined. That means like vegetables. And a little bit of fruit for some people is just fine. But we have these genetic differences. Like Eskimos, they eat a lot of protein. Other people live just fine on mostly vegetation and vegetables. So you're going to have to find your own way, unless you hire someone that can run a test. But what you can do is eat the right amount of protein, fat, good clean fats, and carbohydrates, just a little bit of vegetation for breakfast. Now, 2 hours later, and this is the trick, to find out, besides just measuring your blood sugar, which is easily done, your body's going to tell you if that's the right combination of protein, fat, and carbs in the morning.
Right.
And you want to measure three things. And it's just by taking awareness of yourself and being aware of your own body. Number one thing you should get from food is what? Energy. Okay? You should feel a good sense of strong energy from your food. If you ate 2 hours ago, you should still have, if it was the right meal, if it was the right amount and the right proportions of protein, fat, and carbs, you should have a good sense of solid energy. Now, I'm not talking about energy from coffee where you're tired underneath. That's kind of a nervous energy. We're talking about solid energy. If you've never felt that before, then you really need to work with food. Now, another thing you should get from a good meal, and maybe even this is the first one, is satiation. You should not feel craving. You should not feel like that meal was missing anything. There's a property called satiety, or satiation. So satiety is really critical if the meal was right for you. If you're eating a big bowl of cereal with sugar on it and milk, even if it's 2% or non-fat milk, and then an hour later you aren't satisfied, you don't feel, you got cravings, you think something was missing, you're reaching for more coffee or tea, you're grabbing something, looking for snacks, then that meal did not satisfy you. And you need to play with the protein, fat, and carb. So satiation is one thing, energy is another. That's the second criteria. And the third criteria is going to be your sense of well-being. So sense of well-being is critical. If you feel irritable, there's no reason for that. Unless your boss came in and yelled at you, or your cat made a mistake on the carpet. That's okay to feel irritable over something. But if you feel irritable over nothing, like, gosh, I just feel irritable and I don't know why, that's a symptom that something's wrong. It's a signal that something's wrong. And you focus heavily on diet, and I do too. It's DRESS. It's the first thing. Every person, if you don't straighten out what's going in their mouth 3, 4, 5 times a day, you're not going to have success in your health coaching business. And so diet's critical. Controlling blood sugar is the number one thing. And it's important to know that if you spike your blood sugar by eating too rich of carbohydrates, you're going to get an insulin rush, and then insulin's going to drive blood sugar down, and you're going to get low blood sugar symptoms. You're going to feel almost hypoglycemic. You know, that irritableness, the cravingness, the foggy thinkingness, the sort of laziness all the way around, these kind of things. And then, unfortunately, what satisfies that is more sugar, more carbohydrates. So you end up going in this up and down cycle. You've seen people do that, right, Melissa?
Oh yeah. That's one of the first things I teach my clients how to do, is how to balance their meals. So we use the systems of metabolic typing, but a big part of just learning how to listen. Just listen to your body, because it's going to tell you.
Yeah, those three criteria are I think, good markers. Okay, we'll see you. Thanks. Great markers for measuring the subjective.
Yeah.
Now, the objective can be important too. If we really can't get it right, we have people actually measure their blood sugar before lunch and before dinner. And you can do it when you first get up too.
Yeah.
So your blood sugar should be below 90. You can buy a cheap glucometer at CVS or any drugstore for $50, and it'll last you long enough to do this experiment. All the little things they give you for checking it. You prick your finger, you check it out. Your blood sugar should be below 90 when you wake up, and then you'll eat breakfast. But before lunch, if you have a good amount of time in between, it should be back down to 90. No, it's just going to rise, obviously, after you eat, and it's going to come back down. Now, if it's coming down too low, that's a problem with too much insulin. But if it's coming back down to the right amount, that's good. But if it's not coming down, then you've got an insulin resistance problem. And so it's easy, you can do something. Here's a trick for people. If your blood sugar's not coming down by lunch, if it's still at 110 or 120 or something like that, vanadium. You can go to any health food store, vitamin department, and get some chromium and vanadium. Comes in a combination. It brings blood sugar down. It's a great alternative to something like metformin, one of these pre-diabetes medications people have. And by the way, I have to give the disclaimer: I'm not diagnosing or treating insulin resistance. I'm just giving you a tip what you can do nutritionally to help with to start to stabilize blood sugar levels. Now, that's going to help your hormones tremendously, because you're not putting stress on the adrenal glands. The adrenal glands are what's responsible for making DHEA, which is the parent of estrogen and testosterone. So when you can stop beating up your adrenal glands, stop stressing out your adrenal glands. They're the stress hormones. I mean, made there. The cortisol, which job is to raise blood sugar, by the way. So when you're under stress, you make cortisol. Its job is to raise blood sugar. So you get into this sort of vicious cycle. But the adrenals also make DHEA, dehydroepiandrosterone, and we don't want you, having trouble in that area. That's why women with eating disorders have hormone disorders. Largely, that's a connection. Is that coming through okay?
Yeah, I think so. I mean, because I've heard you speak about this before, and that's essentially why, like, a woman's sex drive like that, right? That's how it's sort of tied to stress, because the cortisol is excessively being released, and that can impact the release or production of DHEA. Is that correct?
Yes, stress kind of lowers your DHEA. The most common thing we see in high stress situations is low DHEA.
Yeah.
So, and DHEA, again, is the parent hormone. It metabolizes into testosterone, which is very involved in the sex drive, and it also metabolizes into estrogen, which is involved in libido, as well as vaginal dryness and hot flashes and night sweats and moodiness and tender breasts and all these different things that could be going on.
Gotcha.
So can diet stress you out? Oh yeah. Wrong diet is very stressful.
Okay.
And will that affect your adrenals? Heck yes. Will that affect your hormone levels? Absolutely. And you know what the symptoms of that are. That's where we started out.
Yeah. So just to kind of recap with the diet, really like the two biggies would be like refined carbohydrates and food sensitivities. Like those are two sort of big things diet-wise that can really kind of throw the hormones up. And then 3 things to be looking for subjectively when you're eating. Energy levels should be good. They should be high. You should feel satiated, so that means feeling full, no cravings. And then you should have a good overall sense of well-being, cool, calm, and collected.
Yeah.
Right? That's how we know we're eating well.
Yeah. Now, listen, people do kind of lean one way or another because we tend to be, we talked about the nervous system a little bit. It's a big thing. It's one of my HIDDEN. One of the hidden stressors or dysfunctions is the nervous system, the distribution of energy. People do lean towards the sympathetic or parasympathetic.
Right.
Very few people right in the middle.
Right.
So your sympathetic dominants, they're your A personalities, and they work themselves into a frenzy about nothing, in my opinion. I'm kidding, because, see, I'm very parasympathetic. Yeah. I'm a very laid-back guy. I really don't let much bother me.
Yeah.
So, I just fix it and move on.
Yeah.
I don't fret about the past at all. I actually live probably too much in the future. But your bottom line is that's important to calm, cool, collected. Yeah, that would be good. But if you're leaning sympathetic, that also could be changed with diet. You need to eat maybe more protein and fat and see if you can't chill out a little bit.
Okay. So, Reed, if someone listening wants to learn more about you, they want to learn more about the FDN course, which I highly recommend. Many of my mentors have gone through it, and it's something actually I plan to pursue. Where does somebody go? How can they learn more about you?
Yeah, it's real simple. FunctionalDiagnosticNutrition.com.
Well, that's it for today. Thank you so much for joining us on this episode of Better Beyond 50. I hope you enjoyed it. If you liked this episode, don't forget to subscribe on betterbeyond50.com, iTunes, the podcast app, or wherever else you might be listening to this show. And if you have a minute, please leave me a quick review on iTunes. I love to hear from you. If you think someone else might like this free show, please take a minute to share it with a friend or family member so she can benefit from it too.